So this video, we're going to talk about why aging can cause the upper eyelids to droop. By the way, I'm Dr. Jordan. I'm a cosmetic dermatologist, and I'm happy to be here to talk about some of these topics. Eyelids droop with age over time because we have depression of brows. The brows start to sag, then the eyelids start to sag. As we age, the orbits, so the eye sockets, they get wider. And so when you lose volume there, there's just more skin around the area. And finally, as we age, that skin becomes a little bit more lax. It loses some of that collagen and elastic tissue over time. So what you probably really want to know is, how do we fix this? The most extreme treatment, which is often some of the best, is surgery. So doing an upper and possibly lower blepharoplasty. This is done by an oculoplastic surgeon and some dermatologists. Now, if you're not ready to go under the knife, there's some minimally invasive approaches that you can also consider. Let me break those down for us. So one of my favorite treatments is going to be laser resurfacing. So using a fractionated laser to tighten up that skin. You want to make sure that you are with an expert professional because our eyes are very important to life, and you want to make sure that you are wearing specialized contacts to protect your eye from the laser treatment. A CO2 resurfacing or a non-ablative resurfacing laser are some of the most common things I do in a day, and we get great results. That laser stimulation will tighten your collagen and your elastic tissue and cause tissue contraction so that the appearance of your texture and that loose skin will help to tighten. The next minimally invasive option you might consider filler or fat transfer. Using some of these techniques to recreate volume can really help to improve the appearance of the eyelids. A lot of times with filler or fat, we can inject in the mid-face, that cheek, which helps improve the appearance of that lower eyelid skin. Particularly though, you don't want the injections to be right under the eye because then that product, filler or fat, can float around in that space. So it's better to be just below that orbital rim into the cheek, and that can create an appearance of improvement. Sometimes treating the temple with some volume also can help lift those brows slightly and give you that millimeter or two of lift around the upper eyelid. The next treatment option might be considered is Botox. Using Botox or another neuromodulator, you can actually treating the crow's feet, which will help to lift and open up the eyes. So that can help lift the brows and improve some of that sagging of the eyelid. This is such an easy method. It doesn't work for everyone, but it's definitely an easy and accessible, minimally invasive option. And finally, there's skincare. Regular use of hyaluronic acids and retinoids will help keep that skin hydrated and help that collagen to stay stimulated by using like a retin A or a retinoid product. So if you ask me, and I probably need all this now, and I do it now, I like combination therapy. I like lasers. I like a little bit of Botox, a little bit of filler, and good moisturizers and skincare. Combination is always the best, in my opinion. So if this is something that's bothering you, please reach out to your local cosmetic dermatologist. I'm sure they'll do a consultation for you. And if you're in the Chicagoland area, drop by and say hi. Thanks for joining us. We'll see you in the next video.